We're ready to go.
Yeah.
Welcome, everyone. This morning, we're going to have a very actually an action time. Most of the time you come and join me, it's all about listening, but today we're going to be doing as well. I have Deanna Hansen with me today, and I first spoke to Deanna probably about 2 years ago, and what was amazing is that she's actualized something that I've always kind of, imagined and hope that people could do for themselves, which is how to begin to open up the fascia. And fascia is like, what's fascia? To me, fascia is probably the most important part of well, it's always hard to make important, but it's a critical part of your connective tissue, of your body. Okay. Fascia is where your acupuncture meridians probably run through, but it contains all your muscles, all your organs. You get rid of everything else, and you still have an outline of your body if all we had was fascia. And why people get chronic inflammation is because their fascia is stuck in places. Anytime you injured yourself, it gets stuck a little bit. And when it gets stuck, you get less blood flow, less clear nervous information, nerve information, and most importantly, you begin to deteriorate your lymph drainage. So, what Deanna has come up with through her own self-exploration and a lot of learning is how people on their own can really begin to open up the fascia, and you'll be amazed at what you can do with your own body as far as and it's helping your healing. Okay, this is not many of you join me to hope to hear the neatest, newest biochemical or medication or supplement that's going to transform your life. Well, that's always a maybe if it's going to work for you. But joining us and following along and learning what Deanna has to teach, that I can promise will help everyone. And that's not something I usually say. So joining us with us today is Darcy, who works with us at Gordon Medical and helps create all this. And she's going to be um, making sure that your questions get answered. And now, welcome. One more important thing. If you signed up, you probably know. But today you're actually going to be doing things. Deanna's going to lead you through after we hear a little bit more about about fascia and why you should care. Then you're going to learn for yourself at home, chair, bed, floor, whatever you can manage. So welcome, Deanna. Really, it's so good to see you again. And I guess fascia. I mean, like, where do you start? How do you think about the connective tissue and life? Life.
First of all, Eric, thank you so very much for having me sharing with your community. I am so very excited to be doing this, and I love diving into the world of fascia, lymphatic drainage, detoxification, all of these things because they're all so beautifully tied together. So, the first thing I want to talk about is how I view fascia. I've spent over 60,000 hours working in people's bodies with my hands, including my own, which is really where I've uncovered a lot of the information I'm going to be sharing with you. So, I personally see the fascia as literally being the cell membrane of every single cell interconnected. It's the most beautiful communication system in the body, communicating all cells together, and it's largely composed of collagen and elastin being the two proteins. And when they're in balance, what's lovely about this is we have space in the body, in the cell, around the cell. And as long as there's space, there's ease of flow of nutrients in and the removal of toxins and debris away from the cell. And that's the goal. We have cells in correct alignment, we have ease of flow, the body's healthy and happy. Unfortunately, however, we are constantly being pulled down by gravity. Plus, unless we've been trained to be conscious breathers and conscious about our alignment, which frankly most people haven't, we start to spiral down in one direction or another because of this lack of connection to how to support proper cell alignment. And what happens to the balance of proteins in the fascia, the collagen, which is the structural component, it starts to migrate to areas of need. So let's say, as an example, I've been sitting in front of a computer for 2 decades in a slumped position. In order for me not to continue to fall forward and land on my face, it's that collagen component that migrates to areas to create building blocks and structure where there's a need for that. But unfortunately, over time, these adhesions ultimately add up and act like scar tissue, blocking flow of nutrients into the cell, as well as the removal of toxins away from the cell. And then basically, this is how we go through time and we age. We pattern our bodies into these negative patterns that continue to pull us down and twist us away from correct alignment. And ultimately, that leads to stagnancy, and we have cells that are basically dirty and hungry and not doing their job well. So over time, we compress. The process I'm going to be sharing with you is fascia decompression, taking your body in the opposite direction to what time has done, so we can open up these spaces that have been congested, blocking flow, pump blood and oxygen into these spaces, clear away and detoxify those areas, and then also teach people proper postural foundation so we can move through time supporting our structure properly. So Eric, I have some before and after photos that I would love to share because we can really see how impactful and efficient this process is when people follow along. So if you're okay with that, I'll share right now.
Absolutely. And while you're getting that up, getting set up, get those pictures up. I just want to remind people that it's the modern world that just has made life easier. I mean, as simple as chairs. Oh, okay. And we'll start with the pictures, but I just want to remind people that just in cultures that don't tend to curl up as we do, they don't have chairs. They sit on the floor, you know?
Exactly.
Huge differences, and our whole world is now made up into getting us into the old man position early in life. So,
Okay, so this was just such a spectacular transformation in 90 days. And this was actually a challenge that we did in our membership. And we always ask people not to change diet and don't do anything other than what you normally do, except add in this journey. So I love this because her name is Connie and the changes are truly remarkable. But what I want to bring to attention here is that there are cause sites to our holding patterns. So let's say you have chronic low back pain or shoulder pain or fatty liver disease, just as an example. I mean, pretty much pick anything. There's going to be a connection throughout the entire body to why these things exist. So when I'm looking at bodies, I really want to understand the cause site so that we can be really efficient at moving people through their issue instead of simply trying to manage the issue lifelong. So if you notice on Connie here, let's just take our eyes down to the front of her ankles. We should have 60% of our body weight on our heels, but the average person has about 80% of their body weight on the balls of their feet because we're not properly supporting alignment. And what happens over time, again, that collagen will migrate. So notice at the front of her ankles here, you can see these lines. These are basically false walls and false floors, that collagen migrating, creating like a scaffolding almost to support the body from tipping forward even further. But these adhesions will hold on to anything in its path, including bone, with a force of up to 2,000 pounds per square inch, locking us into these negative patterns. So Connie had shared before we started this that she'd had shoulder issues for years that she went for therapy for and never resolved. After she completed this program, she was able to move her shoulders freely and her pain was gone. And that was because we addressed the entire body and spent quite a bit of time in that lower body. So you can see how her shoulders are more back and down. She has far more room in her neck. You're going to really see on the side photo the spectacular change in her abdomen, which is basically just inflammation. But just overall, you can really get a sense of how much change has happened. And especially, I always love to see when I look down at the feet how much cleaner the front of the ankles are and how that's really changed the shape of her legs, allowing her to come onto her heels. Now, when we look at her back photo, again, we can see the difference in her shoulders right off the bat. You can see how much length she has created in the low back. You can see that the pelvis is getting more correctly aligned, and she's really brought her center of gravity onto her heels. Now, when we look at her from the side photo, again, remember, we asked people not to change their diet. So this change was not from anything except this work. And that's the inflammation that is getting dumped out of the gut, as well as all the trapped feces, all the toxins that get trapped in that space as we continue to improve that breath. And we're going to talk quite a bit about proper diaphragmatic breathing when we're on the mat. So, also, though, I just wanted to share with you too the change in her neck. So you can see here she's, developing that dowager's hump posture. She has a lot of stagnancy in the throat here. So imagine all the toxins in the head, the brain, they're not getting drained properly because of this alignment. And in 90 days, we see quite a significant change in her after photo. Before I move on to another photo, Eric, did you want to comment on anything
Yeah, well,
or?
I was read my mind. I mean, just for the people out there who, have head pressure, especially wake up in the morning with head pressure. I mean, that's because, and especially if it's worse at night, well, during the day, you get a little help from gravity draining your brain, but at night, you're not getting it. And if your neck looks like her neck does before, you're going to be working a lot harder to get this low pressure system called lymphatics to drain, or everybody's talking about the lymphatics. Well, you need space. And if your neck is 2 inches ahead of your shoulders, you're not going to have a lot of space. Anyway.
Exactly. All right. So then we move on. This was just another example. This was a transformation in 30 days. This was our most recent 30-day full body program. And again, you can just see the shifting in alignment, how that's lifted the rib cage. It's brought more length to the abdomen. She's definitely come onto her heels more. I know this is a little bit dark here, but she's got so much tension in the feet. The feet really, besides the breath, the feet are like the biggest issue that we're going to be talking about as well. But then again, in 30 days to see the change without changing diet, like this is really what I want to bring home here. We were so caught into calories in the past, and really, in my view, calories, looking at that as what we need to manage weight, has so little to do with what's actually going on. It's the inflammation and the toxins that create the expansion. We compress and balloon, and wherever we're compressed, we're locking in cells, we're holding in debris, and then as we continue to compress further, we keep ballooning more. So as we lengthen, we really bring that rib cage up, we align the pelvis, and then we start to see some beautiful changes in here.
Yeah,
So
and in talking about weight, when just looking at these pictures, as the liver can actually drain itself and not be overwhelmed by all the garbage that the body's dumping into it, it stops sending as many inflammatory signals, and your fat cells stop being so inflamed because they too can drain, and that's what causes the insulin resistance is this fat cells that are inflamed. So everywhere you can dump, you got a better shot at not holding on to stuff you don't need.
exactly. And then I love this one because it's not just about how we look as regarding size, because this woman, again, who did our 30-day program, she isn't needing, I'm just going to put that in quotes, needing to lose size, but you can see the beautiful change in her alignment by doing this work. So it's really not about size and shape as much as it's about cell alignment and making sure that those cells are being properly fed and clean lifelong. Because if there's ease of flow, the body moves through time with ease and grace. It's when we have dis-ease in the flow that we start to see stagnancy. And wherever the areas are stagnant, it might be an organ, it might be a muscle tissue, it might be anything, but wherever there's stagnancy, there's going to be compromised ability for function. We're going to feel pain, we're going to have issues. So I just wanted to share that as well because it was such a stunning shift in her posture. And again, noticing just here what's going on in the neck. As much as she has a nice jawline in this before, to bring her rib cage and heart and lungs to the forefront of the body instead of being at the back here and creating that beautiful lift of the rib cage, we've now cleaned up this area, which again is the major lymphatic drainage site in the body. And also we've really optimized her breath to support lymphatics in the gut.
Yeah, that's amazing because that mediastinum we talk about the area between the sternum, the breastbone and the backbone. And I say we, hardly anybody talks about that, but that's why I'm always having you go to osteopaths and chiropractors and people who do cranial. And this is an example of the amazing work that you can do at home to
Yes.
open this area up.
And again, this was 30 days. So
Yeah,
it's
that's amazing.
if you commit to the daily practice, it really doesn't take long to see some phenomenal changes. And then this was lovely because this was I have a client who does thermography images, and she did this before image with one of our community members who in 3 months did the process, and then she took the after image, and she said she's never seen anything so dramatic in that short of a time. All of the red is the stagnant inflammation, and in 3 months you can see deep down in the body the changes that are happening. And of course, right where we're seeing a lot of this inflammation is right where the diaphragm lives. So again, we're going to talk a ton about that when we're on the mat, but I just wanted to share with you, here's another visual to give you a sense that it's not just surface stuff that we're dealing with, but we're getting deep inside the body to really clean out what's going on here.
Wow.
Okay, so I'm going to stop sharing, and I think it's time to have some fun with everyone.
Wow. That's amazing. Yeah, I thought we were just getting going. Okay, we now we get to learn how to do this. I think this is
Exactly. Yes.
okay.
Okay. So, just a couple of things. First of all, if you're pregnant, I do not want you doing the first position I'm going to be sharing. We're going to be moving right into the abdomen. What you can do is you can lie on your back. You can place the towel and then you can just apply some pressure with your hands. So that's really the one contraindication. The other thing is we always share your breath as your guide. We're going to be moving into the body with intention with the goal of finding pain. But as long as you're breathing in a relaxed way, you will be feeding and healing the area. If anything hurts so much that it's causing your breath to be stressed, that is your body saying, this is too intense for you. So now I'm going to be doing this work on a floor. This work can be done on a bed. If it's done on a bed, it will be less intense. And then there's so many ways we can also approach this work from a seated position. So a lot of the things I might be sharing won't make sense if you're simply seated, but there's so many things in our program where we share with you how to do seated work. So just to note, if you struggle to get up and down from the floor, this doesn't mean you can't do this practice. And then essentially there's no other contraindications. Again, your breath is really the key to if this is appropriate for you or not. So I'm just going to share with you how to roll this up. So this is a bath towel, and I basically just folded it into four. So we're just going to fold it in half one more time. And then we're just going to roll it up nice and dense. So try to get it as nice and dense as possible. And what's really nice about this is if in any position you feel that the towel might be a little too high, you can simply take out some of the roll so it's less intense. So that's another avenue for you if you're finding that any position is a little too much. And now I'm just going to put an elastic band around this just so it stays nice and clean. And we're ready to dive in. So the very first thing that we always do is we always start in the belly. And before we do, I just want to explain a couple of things quickly about the breath. So your diaphragm muscle is the foundation of the rib cage. When working properly, when we exhale, it moves down into the body. When we inhale, it moves down. When we exhale, it lifts. When it's working properly, it's giving all of the contents in this area a continual massage. So we have our stomach, our pancreas, our liver, gallbladder, the heart and the lungs, the aorta. And when we have space for that and we have this muscle working, we're putting energy into the system, we're supporting the organs. However, again, our reality is we have compressed over time. Pain, fear, and stress cause you to reactively hold the breath, but we're designed to survive. So if we don't release a trauma in the moment, we get patterned into that negative breath, that collapse. So we end up being forced to breathe through the muscles of the upper chest. But if we become chronic upper chest breathers, which frankly the majority of the population are breathing that way, now this muscle becomes weak. The weight of everything above causes the rib cage to come crashing into the core. And we compress, we balloon, we displace, we don't have that mechanical action providing extra energy here, and then things simply aren't working as well as they can. So a lot of this is really to optimize proper diaphragmatic breathing. And unless you can't, we always want to breathe in and out through the nose. So to begin, we're going to place the towel right on the belly button and we're going to lie on it. So take your time getting into this. And we're going to be in here for about 3 minutes. And stay upon your elbows at first. This gives you nice control. And to begin, we really want to teach you where the breath should come from. So let's inhale into the towel. We want the movement to come from the belly. And you may feel some interesting sensations. You may feel pain, pressure, a pulse. All of these are normal. Remember, your breath is your guide. And we never want to force the body. It doesn't serve us. We want to persuade it. So we always want to be kind to the body, and the breath will help lead you along. Now let's shift our focus to the exhalation phase of the breath. This is really the key to proper diaphragmatic breathing. We want to make the exhale the focus of the breath. So first of all, just get a sense that as you exhale, the towel is moving up into the core. Allow the towel to sink as deeply as possible. And let's exhale for a count of 6. Inhale for a count of 4, not seconds, just whatever that count is for you. And we're going to spend 1 more minute here. After you've exhaled fully, see if you can even hold for a moment before engaging the inhale. And just become aware of what surfaces for you. It might be anxiety, it might be a deep feeling of calm. Just notice. When we exhale for longer than we inhale, we increase the carbon dioxide levels in the blood, and that is the currency for the oxygen to jump from the hemoglobin into the cell. So this is really important. It also turns on the parasympathetic nervous system, which we need for our healing state. So the more we can focus on that full exhale, the better. We'll take 3 more slow breaths here. And then when you're ready, let's just place the hands under the shoulders and slowly exhale up and out of position. And okay, and just notice how you feel. You might feel heat. You might feel a little bit greater ease lifting the rib cage. Just become aware. Now, the next 2 positions we're going to do are going to be to help broaden the pelvis. So I just want you to feel that pointer bone. It's called the ASIS bone. We're going to lie directly on it. So place your towel. We'll start on the left side. You can take that right out to the side for balance. And then just place that bone right on top of the towel. And just take a moment here to just find your balance. Focus on that exhalation. And then just know that, again, your breath being your guide, I'm going to be taking you through some movements and actions. I want you to stay in whatever position makes sense for you that your breath allows. And for some of you, simply being here may be more than enough sensation. But if you want to go a little bit deeper, let's put the hands and forearms planted on the floor and gently draw your body over to the right. We're not sliding on the towel. We have sunk into the towel and we are just moving these micro movements over to the right. And you may feel as though the tissue is peeling away from the bone. We are working to broaden the pelvis. And just Stay again focused on that full exhale, which helps us move the toxins and the pain up and out of the body. If you want to see if you can go a little deeper, we can walk the upper body to the right in a bit of a twist as we continue to draw the body over to the right. And when you're exhaling, get a sense that you're squeezing the belly small and then relaxing as the belly expands. See if you can twist a little bit more. Continue to draw the body over to the right a little further. And then let's slowly walk the upper body back to that neutral alignment. And then when you're ready, hands under the shoulders and just exhale as you lift up, off. And now we will do that same position on the right side. So again, that left leg will go out to the left just for some balance. Place that pointer right on the towel. And just take a moment to settle in, connect to your breath, and know that both sides are different. You may have very little sensation on one side and a lot on the other. So again, just become aware of what your body is sharing with you. And now, if you choose, let's slowly draw the body over to the left, getting a sense of that peeling. And you can even walk the upper body to the left in a bit of a twist. And you can continue to draw the body a little further to the left. As we start melting these adhesions, the area becomes more liquid. When there's blockage and adhesion in the fascia, it becomes dehydrated and dry. Just like ice, we want to turn the ice into water through the process of melting. Pressure over time creates heat. And when you combine that with proper diaphragmatic breathing, it's like you're turning on your body's furnace. And the two together are very efficient at melting these adhesions. See if you can twist a little deeper. And just notice as well how the sensation of pain changes over time. The pressure fibers in the body are larger in diameter than the pain fibers. So as you apply pressure, the pain eventually changes to what most people explain as a good pain. Let's slowly walk the upper body back to neutral. And when you're ready, you can place the hands under the shoulders and slowly exhale up and off the towel. And then just come back to seated for a moment. We're going to do a couple of positions in the upper body through here. So before we start, I just want you to take your left arm and just go through a range of motion. Just notice the range that you have. Also notice the quality of the movement. You might feel grinding or you might even hear it. And then also do the same thing on the right side. And then we're going to do two positions on the left side, and then we're going to feel how the change happened. So this next position is the upper side rib. So it's about nipple height. We're going to be doing it on the side. Why this is so important is when we start falling out of alignment, the shoulder blades will migrate up and around and glue to the ribs through here, locking us into this negative alignment. So we are going to release that now. So lying on your side, slowly getting into position. And again, you don't have to be super specific about exactness of location, but about nipple height. You can support your head in your hand, keep the knees bent initially. And this may be more than enough for some of you from a sense of sensation and natural breathing. We want to test the limits though with the breath. So let's just start by rocking forward and backward, nice and gently. And again, just become aware of the sensations. We are actually seeking pain. Pain equals adhesion. So we want to find the pain so that we can spend some time with it, melt it, and then move deeper to find those deeper, older pains. We're going backward through time in our tissue. Now, to go even a little deeper here, you can lean into this top hand. So for the ladies, you're going to get a sense that you're compressing the outer portion of that breast. Might feel a little strange. You can also take the top leg to the floor, straighten the bottom leg. To go even deeper, we can take that left hand to the top of the mat, walk the fingers away to really lengthen the arm away from the body. And then let's take that left hand to the left. We're opening up this area to support the lymphatics, as well as that shoulder range of motion. And be sure to stay focused on that full exhale. Now, to go even a little deeper, you can come onto the fingertips of that left hand or even lift it up off the floor. This adds quite a bit of additional pressure into this space. Always respect your limits. And then we can even take that left hand a little further to the left if possible. Let's spend 3 slow exhales here, whether your hand is up or on the floor. And then you can slowly take that arm back to the top of the mat, bring your body back to neutral. And just take a moment. You can just rock forward and backward once again, just to feel. And then lean into that top hand and exhale up. And then the next position that we're going to do, we're going to actually sandwich the hand between the glute and the towel. We're going to be lying on our back. I'll show you in a moment. But anatomical position is palms forward. Most people are walking around with their palms facing the back of the body. The wrists lock us because fascia will grip and adhere to the feet and the hands with the most force. So we really want to focus on releasing these. So the left position, get on your back. And then we're just going to lift the butt up, place the towel under the left glute, and then we're going to sandwich the wrist between the towel and the glute. So you can just maneuver the towel so it feels comfortable for you. And then before we do anything, let's place that right hand on the belly. When you inhale, make the belly nice and big, just to ensure the breath is coming from that right place. Now, if we want to go a little deeper, we can extend that left leg. And then we can use that right foot for leverage as we explore left to right. And we're not moving fast, we're moving nice and slow. The slower we move, the deeper we melt. And we want to get all the way to the bone. That's where those adhesions will grip with a 2,000 pound per square inch seal, which is a magnetic seal, but it so strongly locks us in these negative alignments. So we want to be persistent and persuasive, not forceful.
Hey, Deanna, I think we have a
Yes?
question here that this might be good timing for it. So
Okay.
a hand question. So she's had fascia treatment before. Her OT just said it looks like she has a trigger finger. How
Yep.
can fascia treatment help?
Great question. This will be one great position to do, but one of the positions or one of the exercises I'm going to show you at the end with the finger webbing will be a great one to talk about.
Terrific.
Now, if you want to go a little deeper here, you can also lift that left leg up and you can slowly start to explore. So you may feel more sensation in the glute. You may feel more in the wrist. We want to address both areas, So this is a nice double whammy for your time. But just notice how things are feeling. I always like to imagine I'm in the middle of the ocean, just going with the flow, letting the current take me into whatever positions my body is drawn into.
And
We'll
I just
spend one more minute here.
If we got a minute, okay, because somebody brought up a very important point that I should have addressed earlier, which is the idea of if people are really ill and have a lot of toxic load, um, binders before you start would be a good idea. And most importantly, beginning with one of these positions and seeing how you feel afterwards. I think that's important. It's just to go slow and
Yes.
find out what your body can tolerate because it might feel really good in the moment, but I think the simplest thing, if you're somebody who has had body work done, a massage or any kind of body work, and you feel great, and then, an hour or the next day you feel like a truck hit you, um, then go slow because you're doing the same work. Okay. The beauty here is that it's under your control.
Yes.
So,
So let's
very
bring that
important.
left foot back to the floor and then just slowly lift up, take the hand away, roll over to one side, come back up to seated, and then let's just check in with that shoulder range of motion. Let's notice the quality, the range. You may have noticed there's an improvement. Just become aware. And now let's do those same two things on the right side. So again, nipple height, we're going to lie on the side. Support your head in your hand. Keep those knees bent initially. And remember, if this is all you choose to do, that's totally fine. If you want to up it a little bit, we can just gently rock forward and backward to begin. And again, to Eric's point, just reiterating that we never want to force the body. We want to persuade it, and we all have to find our own way through this. And that's another thing that I love about this too, is nobody knows your body better than you do. So this is really to also help you become more connected to the deeper cells than what you're consciously aware. And then your intuition becomes stronger about what is best for you and your health going forward. Now, if you want to increase this, we can lean into that top hand. So we're compressing that lateral breast tissue. You can take that top leg to the floor, straighten the bottom leg. And then you can take the right hand to the top of the mat, walk the fingers away.
Deanna, I'm going to ask you another question while you're in that pose.
Okay.
All my acute symptoms, scoliosis, disc, sciatica, outer heel on the right side, but all stiffness on the left side. And these exercises making left side painful. Can you explain this?
Yeah, so there's a driver and an anchor. Actually, Darcy, I'd really like to, when I'm done this, stand up and do a quick discussion about driver anchor so people really have a good understanding.
Perfect.
Okay. Now, if you want to take that right hand over to the right to open up the space a little more deeply, and then you could even come up onto the fingers or lift the hand if that's appropriate for you. And you can see if you can move that right hand over to the right a little bit more. We'll do 3 more slow breaths here. And then let's slowly come back to that sideline position. And you can just gently rock forward and backward for another couple of breaths. And when you're ready, just lean into that top hand and slowly exhale up. and out. And now we'll do that right hand. So again, we'll get onto our back, place the towel under the right glute, and then we'll sandwich that wrist. Once in position, if you choose, you can straighten that right leg to get a little more sensation and use that left foot as leverage so you can slowly rock right to left. And remember again to always breathe in and out through the nose unless for some reason you can't.
And I've got another one here I think you can answer while you're in place. Can this help with lymphedema in the fingers and hands after a wrist break?
Yes, absolutely. And again, the finger work I'm going to be sharing once I'm done here will be really helpful with that. Now, if you want to ramp this up, you can bring this right leg up and just slowly start exploring. And again, the slower we move, the more intentional we are, the deeper we get. And let's take 3 more slow exhales here. And then you can place that foot down and just lift up, take the towel out, roll to one side, exhale up to seated. And then let's just check in with this right shoulder and see if we've made some progress with range. And sometimes things get worse before they get better. So again, this is really just about exploring and seeing what happens. Change is the goal. And because we're tapping into the system that we've basically lived with until this moment and all of the negative patterns, now we're starting to disrupt those patterns so that we can create change. Change is the goal initially. Healing is never a straight line. So one more position with the towel. We're going to be doing the diaphragm. Before we begin, take your arms to the side and then just draw them back as far as you can so you get a sense of how you feel with this action. And then we are going to lie on the towel right on the diaphragm. So for the women, just below the breasts. So basically just find those lower ribs and we will lie right on top. And you can just stay up on the elbows. So we have so much going on here. Of course, we have all the organs. We have the aorta, again, the main artery leaving the heart. When we compress and balloon, we're restricting blood flow from the heart. So the heart has to work harder. So making sure that this area is nice and open is a huge goal for us. So let's focus on that full exhale. Feel the belly moving up into the core, lifting off the floor. And now we can take that right hand to the right of the mat and just add a little pressure so we're moving our intention to the left side of the ribs here. So right now we're basically right on top of where the aorta is. We're on the stomach. Because most people are right-handed, we end up collapsing with so much more force into this side of the body. So to create that space in through here is extremely important for long-term health. And now as you're here, let's see if we can just gently twist the upper body to the right. These twists are what really help us open up the fascia and get to those deeper adhesions. And then allow the body to come back to that neutral alignment. And now we can take the left hand, add some pressure so we're focused on that right side. So many people have fatty liver disease, and think of butter at room temperature as a solid. When you heat it, it's a liquid. If the fats clog the liver can't do its job, and it has so many jobs. So to apply pressure over time as we focus on the exhale, we start to mobilize the fats that have been blocking the liver to support proper liver function. And of course, from the perspective of detox, the liver is a key organ that we support with this. If you want to twist nice and gently, just to get a little bit deeper, we'll take 3 more breaths here. And then let's slowly bring the body back to neutral. And then place your hands under your shoulders. Slowly exhale up. You can just place the towel off to the side, come back to seated. And then let's just go back into that movement. Let's see if we've gained some range. Our goal is that we have the heart and the lungs at the front of the rib cage. When we collapse, they get pushed to the back and we block the energy for them. Okay, so this next one I want to share, it's going to look really funny, but it will be so impactful to improve your lymphatic drainage in the head, the eyes, this whole space. I'm going to look funny and I'm going to do my best to share it here. I'm going to take my third and fourth finger of both hands, but I'm going to first show you with just my right hand. We're going to put the fingers on the inside of the mouth, below the teeth, and you want to move down so that you're at the gum. And then we're going to do it with both hands. When your hands are in there, the goal is that we draw the hands away because we want to broaden the lower jaw. And we also want to push the fingers down slightly so we can melt the adhesions that have stuck the tongue in this negative alignment. People don't have a double chin, they have a displaced and weak tongue, which impacts circulation to this space as well as lymphatic drainage. So this is what it's going to look like with both hands. So you keep doing that. I'm going to make sure that we're doing it for about 3 minutes as I talk through this. If your mouth is small and you feel you can't fit both fingers in, start with one finger. And if you make this a daily practice, which I do every day for 3 minutes, this is the first thing I do when I wake up, this will change so much. The jaw is connected to the diaphragm, which is connected to the pelvis. Everything is mirroring. And over time, the head starts to change shape and the jaw does not articulate properly. And again, this causes a ton of things, not only with function, but also how we look. This is really going to help give a beautiful lift to the face. So now as you continue to draw away, see if you can also bring the fingers down. You may notice that one side is a lot denser. You might have a lot more pain in one side. And as your fingers are pointing down into the tissue as well as drawing away, see if you can start to move the tongue slightly. The moving of the tongue is going to help to dislodge some of those deeper adhesions as well. Let's just take 3 more slow exhales here. And when it's time to remove your fingers, be really cautious because sometimes the fingers get really sticky and almost feel dry as we're opening up to those layers of adhesion. So if you just pull your fingers out really fast, you may feel some discomfort. So we just want to take our time and be really thoughtful as we take the fingers up and out, which you can absolutely do right now. So that is the tongue decompression technique. That is one of my favorite things. It's like truly going viral in our community and on social media because of the amazing benefits. So again, for the lymphatic drainage, really important in this area. Now, there's two more things I want to share with you. I'm not going to go through the exercise because it would take too much time, but I want to talk about this and how important it is. Now, I just have a string. So you can have a cord, you can have a skipping rope, a string. You can also use a finger or a pencil. And the thing is with the feet, there's a video we have called Death Starts in the Feet because the feet are literally the furthest from your body's engine. So the patterning of the fascia in the feet are the most impactful holding pattern for everything up the chain. If you have frozen shoulder, if you have migraines, if you have a ballooning belly like we saw in those before photos, it's the work in the feet that is really key to change the patterning of how we walk so that we can bring our center of gravity back to the heel. So if you're using your finger, all we're going to do is put the finger between each toe, and we want to hold for 3 minutes as you focus on the exhale. And we're not just placing it. We want to get in there and we want to feel the pain because we want to create more space. And again, take away that twisting patterning of the toes. You can use a pencil. Now, if you don't have good range of motion, this is where the string comes in because you can just wrap it around and you can be seated and then you can pull and draw and hold as again, you focus on that exhale. And we want to do it between each toe for 3 minutes on both feet. That is going to be a game changer if you do that daily or as regularly as you can. And similarly for the hands, because again, the hands are the next furthest from your engine. And remember, most of us are collapsed and we have internal rotation of the arms impacting the hands. So we can do the hands a little faster. We want to put between the thumb and index finger spread apart and move into the webbing. And I'm showing you up here, but we want to actually draw the shoulder blades back and down so you're not forcing. So we want to just be nice and relaxed and move in to the point where you feel that pain, hold for 3 minutes. Then you go between the second and third, spread the fingers apart, move, feel that. Then between the third and the fourth, this is where I feel the most sensation. And then between the fourth and the fifth. This work with the toes and fingers, if all you did was toes, fingers, jaw, and breath, things would change pretty dramatically if this becomes a consistent practice for you. So those are the things that I wanted to share with you, and I'd love to chat.
Eric, you can hop back on. There we go.
Yeah.
Okay. All right. You got it. You got all the questions. Deanna, we were just having a little conversation about the tongue decompression.
The
Okay.
teeth.
A good one
Yeah,
or a
yeah.
bad one?
No, no, a good one, but maybe just because someone asked a question and assumptions. It's inside the teeth that you're pressing down. So it's next to your tongue. Your tongue is touching your fingers. Is that correct?
Yes, yes.
Yeah.
So it's
Yeah.
on the inside of the teeth down, so you're actually on the gums. The reason I started doing this, I have two molars that I've had removed, and I did not want implants or root canal. So I have the space here. And if we let the space go unchecked, eventually those teeth are going to start to migrate and move in toward each other, and that will affect my jaw. So rather than trying to keep the teeth correct, we want to keep the jaw nice and broad. So this is really impactful to, again, bring that symmetry into the jaw so that we can open up those lymphatics, keep the tongue nice and aligned. And the thing is about the tongue, it should be supporting the roof of the mouth. If I'm not conscious of my tongue alignment, it will move too far forward and to the right, and I end up clenching more on my left. So if we can notice at the roof of the mouth, about a pinky nail distance from the teeth, there's a ridge. The tongue perfectly docks into that ridge. So the surface of the tongue should be supporting the roof of the mouth. You can even suction the tongue up there. And for some people, to place it in correct alignment is challenging because of how it's being manipulated. People with tongue ties, this is great work for. Anybody really, this is important work for. But this will help to broaden the jaw and support keeping the bone dense as well, because of course we also lose bone density over time, but pressure into bone increases osteoblast formation to make sure our structure is nice and strong.
Yeah. I just have to say, I'm just doing the mouth one. I just feel like my whole head just opened up. That
Yeah,
was that was
it's pretty
amazing.
wild. I
Yeah.
had people when I was sharing on my community, they were saying that they could feel the shifting in their pelvis.
Yeah.
So, I mean, everything is connected. It's fantastic.
Wow. Yeah.
Now, Darcy, you had asked that question I wanted to share standing just about the driver and the anchor. So I'm just going to stand up. My head may be cut off, but I just want to talk a little bit about alignment and what happens with the body. So we're like a building. And like a building, if we support proper foundations, everything inside is contained. However, because again, we're not conscious and we're dominant on one side, we tend to shift. So there's always one foot that's going to be like a driver pulling us away from alignment. And then the other side of the body is going to anchor so we don't fall forward. Think if you're walking a 120-pound dog that's well trained, there's no tugging on the body. But if it's tugging you, it's going to be the opposite side that's going to contract so you don't fall flat on your face. So we have this slow moving system going throughout the body as we continue to deepen these patterns in our fascia that will keep pulling us down toward the earth. And it's going to be the side that you're using most dominantly will be your driver. The opposite side will be your anchor. And that creates twisting and chaos up the chain. That's where the adhesions start forming and create structural support, but at the expense of flow. So again, to bring the body back to balance is the goal, and it's a journey, but this is a very simple program to follow as a day by day to really optimize the benefits of supporting your fascia and your breath.
Right. That was the question. Someone just asked that same question, explain the anchor, the anchor. And just, I think there was a question about one thing real quick, the risk of bruising. Um, Sometimes that's just because there's a lot of really poor flow, and that's when people often will bruise.
Yeah, 100%. And I mean, bruising is a great sign. It's not bruising from breakage. We're not like forcing and creating a rupture. What we're doing when we're doing this work is we are moving blood and oxygen into spaces previously blocked. So once we create an opening and we get some oxygen in there, those hungry cells take the oxygen, and then the area is left blue because deoxygenated blood is blue. So that's where that bruising comes from. And it's really just a sign you've made progress, but you need to continue. So bruising in this way is not negative. It's just really a sign that change is happening and we just need to do more work.
Yeah, yeah. So it's not a danger signal.
No,
You know.
not at all.
Uh, okay. It's so many. Yeah. I want to. Hmm. Okay. It seems. Somebody asked a question of really understanding of sensation, and I think that's probably the beginning of it. Um, is just sensation, is find your sensation, is because if you're not feeling it, then use a little more pressure, you know. Um, and someone else asked, this is to be done. You don't have to be hurting. This is the
No.
thing to do to just get you better, not wait till you hurt.
100%. And the thing is, when we're searching for pain, our brain can only handle so much incoming information. So, especially if you're in a lot of pain in different areas, we feel what our brain can deal with. What we are doing, we're not adding pain to the body, we're pulling up the deeper pain than what you're consciously aware of so that we can pull it up, address it, and exhale it out of the body. And from a trauma perspective, I mean, think of having a trauma when you're 3, 4, 5 years old, when you're in your developmental stages. What happens with trauma is we reactively hold the breath. We're always trying to support ourselves. So something happens and we hold our breath and we lock ourselves. Like a deer who survives an attack, after they survive, they shake. They move that negative energy that came into the body out. Where we as humans, we tend to hold it and freeze and then age from that place. So if those traumas happen at a really young time in our life, we are developing with an impaired diaphragm, and that's going to cause a whole raft of long-term issues down the road. Autoimmune issues, I mean, call it what you want, but a lot of lymphedema, those kinds of things. So this is all really a function of making sure that our fascia system is supported and healthy. I just noticed my camera went off there. I'm not sure if, oh, yeah, I'm just going to click the
Yeah,
video.
What
There we go.
There you are again. I'm just going to jump in and say something, Deanna. Here, I want you to just address the hand. The question specifically was, if my hands and feet don't hurt, why, why should I be doing this work? Because you said that work should be done
So,
daily.
okay, as a little test with the hand, for example, see if you can move a little bit more deeply because sometimes we're so frozen that we don't have sensation until on the surface until we actually start bringing energy into the body. So that's one thing. But sometimes we just simply have to search a little bit deeper. And if we're just moving the fingers in and holding, I mean, I don't feel pain here, but if I spread my fingers apart and actively push in, it doesn't take much for me to feel pain. So the thing is, no matter what, your fingers and your toes are not perfectly aligned, and all of your patterns are stuck and held in your limbs. I always say the limbs are the puppet masters of the core. If you have a scoliosis, the spine is the response of the limbs pulling you in different directions. And what happens? If you have a big ballooned belly, the limbs are holding you in this compressed ballooned state. So if we don't release what's going on in the limbs, we can't bring that core back into correct alignment, as well as everything up the chain into the head and the neck as well.
Yeah. And it's just bringing your brain, you know, when we get injured, okay, and the injury doesn't heal well because of whatever local reasons are happening, your brain begins to pay less attention to that area. And so this, I mean, on some, so we have the local pressure, which is opening the blood flow, but we're also reminding our central nervous system that this is an important part of the body. Pay attention. It wants to get well. It's waking up the brain to the parts that it just has learned to ignore because it's noisy. I mean, it's not helpful. So you stop paying attention.
And Eric, on that note, I would also love to just talk about acute injury and how we have been led to heal and how that has been problematic in the big picture of what really we are capable of from a perspective of healing. So when we have an injury, whether it's a break, it's a tear, whatever it is, there's a gap that gets created. Second law of thermodynamics, nature abhors a gradient. When there's a gap in the system, nature's going to fill in that gap. So if I have an ankle sprain, what's happening is we're directing blood and oxygen and nutrients to the area of need so that a rebuilding can occur. However, we have been trained. I'm an athletic therapist, and I was trained the RICE method, as the majority of us have been, rest, ice, compression, elevation, to limit inflammation for the first 20 or 48 to 72 hours. So what happens with that is the gap is still there. Now, when that injury is needing the most love and attention, we're actually slowing down the body's natural response. So, all of the surrounding tissue is going to, the collagen from the surrounding tissue is going to dump into that gap and create a scar. But collagen without the balance of collagen and elastin is basically a sticky, thick, gluey mess with really no life in it. What we really want to understand is the body knows how to heal, but we need to support that natural process. So when we have an injury and there's inflammation, we want to add energy through heat, through conscious movement, and this work, and your breath to support that. Think of baking a cake. If you have all the raw ingredients and you create batter, and you put batter in the freezer, you have frozen batter. If you put the batter into the oven, you bake the cake. So the body will rebuild the tissue properly if we give the energy to the body when it's needed instead of stopping. Now, of course, stagnant inflammation is problematic and it can damage more and cause other issues. But the reason it's stagnant is because of the adhesions that have developed over time, as well as that lack of breath. The diaphragm is your body's engine and your body's furnace. It's what keeps it keeps the fluids moving, the blood flow, the lymph flow. It keeps everything flowing. When we have a compromised breath and we're breathing up through here, we're colder than we should be. We're more sluggish than we should be. We're not absorbing nearly the amount of oxygen available to us, and we're also not moving the toxins efficiently out of the body through that proper exhale.
Yeah. One of the discussions, and we don't have, I mean, that will be a very long discussion, is healing. because you see, you brought up a very good point, is that we are using tools that are probably more useful if the body has failed to heal. Okay, because you see, when you're that first step in healing is an inflammatory response. Now, the problem is if that doesn't stop or becomes too big, it makes a mess. But in medicine, just as you said, we're teaching everyone to use an approach that is stopping too early. You're not even giving your body a chance to go through that original. You're deciding beforehand that the body's going to make too much inflammation, so we're going to shut it down. And that's a discussion that we should have. I'd like to go deep with you because it's a way of thinking. It's our whole problem with medicine today is we're using the wrong tool at the wrong time. We,
And I mean, I would love to have a long conversation because I love this conversation, but the body knows what the body needs to do its job. So when it comes to the repair, if more inflammation is continually being sent, it's because the area isn't repaired yet. So that's just it. When we limit that inflammation, now it's never fully repaired because now we have this scar, and that scar alone, like think of if I took a big round circle out of my shirt and I sewed it together, I'm never the same shirt.
yeah,
So we want to keep our tissue as it should be. And as soon as we start, playing around with the body that way, I love the conversation around keloid scars. Like, why do some people scar with a keloid scar? And to me, it's really simple. If I took this shirt and I cut it, there's a little thin line of collagen that from that surrounding that has to dump in to create the scar. But if I'm super chaotic and I've got this big towel and it's all mashed together and I cut through it, there's all these layers of tissue surrounding it that have to dump in the collagen from that surrounding amount. So now we have more collagen coming into the scar, creating a keloid scar, which to me is simply an indication that the body in its fascia alignment is very chaotic.
yeah. Well, I said we can take this far places, but when come back to the most important. I was taking it. The most important thing is that simple pressure and breath can begin to open the flow. And I think that is, and just if people would just keep doing this, and I said I've watched your videos for, and because you can get once you watch them and you learn how to use the tools, you can really be creative in your own body.
Yes.
But first, learn the beginning steps and open that diaphragm, because if that diaphragm isn't open, those are the people who are really going to get some toxic dumps that aren't going to feel good.
And that's where when we can also add in the toe and the handwork. I remember it was uh, another Dr. Eric. Sorry, his last name is, I'm lost on it. Anyways, he was doing TRE. And when he was doing that trauma release energy,
Right.
they would experience sometimes if you're really toxic, then it can be a negative result because, again, those toxins stay stuck. But because he had worked on his feet and his calves, when he was working with the founder of TRE, he was blown away by the changes in the result that the TRE was giving him because he'd opened those channels so the negative energy could move out appropriately. And we can do that through the feet, calves, as well as the breath. So, really, again, this is a full body journey. Once you dive in, what we shared today was a little tiny sampling of what you have access to.
Yeah. And just to remind people, the less you're able to move in your life, the better, and not the better, but the more powerful you're going to find this in the beginning. Because when you don't move, this is like mind blowing. Just this pressure and the opening.
Yes.
It's your body's gonna feel things that it hasn't felt in a long time. And if it feels a little scary, breathe, binders if you need, go slow, but it will open places that need opening. And it's just, what I love about this is the wherever you are in health or illness, this will make a difference in a positive way. Just go slow if you need to, but do it.
And honestly, the people that I have worked with that are the most problematic are the people that are really fit. because they have trained their body to be very strong in a certain way, but that doesn't equate to open and flow. We want to be healthy and fit, but if you put fit in front of health, then I'm seeing the people that were like the fittest in their youngest years, the biggest issues in their older years, and they're also the hardest bodies to melt through because of that powerful intention to create a build in a specific way.
Oh, yeah, no, no, that is very, very true. And we can go down another rabbit hole about that. Yes. Um, but for our population, the people who are really struggling, just to get close to a normal, even homebound life, this can really open up your energy flow, and you will be surprised. And again, and it can maybe, but go slow. I mean, I think that's one of the things that I want to emphasize, and I didn't maybe in the beginning, is that don't overdo. Go slow. If you know that you react to massage or any kind of or sauna, things like simple things that should just make you feel wonderful. If they make you feel good and then feel crappy, go slow. But this, you can control this. It will open and it will let those organs do the work of the detox that we all keep talking about. And this is, you do it, your floor, your bed, you can do it.
If I may share just quickly on that point. So Gary Sharp, who is one of our community members of 5 years, he has a site called Outthinking Parkinson's. When he began this journey, he probably spent months just working the first three positions that we have. And then some days he would have to spend no time on the block because he had taken so many meds, his liver was really toxic. Now he's thriving. And it was for him to figure out because, of course, same what you're saying is what happened to him. So now he can do full body work. And again, like he's thriving and he shares our work on his platform, but he did take it one step at a time. And again, you know your body. If you know that this is your situation, this will work. But and that doesn't mean that if you overdo it one day and you have a consequence on the next day, like, oh my gosh, you can't do this. That's just giving you information to slow down. And it takes a little bit of time to figure out the cadence for what makes sense for you. And then as you start to clean out the lymphatics and the debris in your body, then you can start to increase the intensity if that's the case. Other people can dive in and they can just go to town. But again, we're all different. So again, respecting our limits is really the key.
Yes. So, Darcy, our timekeeper, where are we with life?
Yeah, you can do a couple more questions if you'd like. We're at quarter after. So let's find one or two that you really like, Eric, and then we'll wrap up. Oh,
Uh,
I also want to say that I did drop in the free series that Deanna is offering into the chat as well. So grab that link.
Now, Darcy, you had mentioned about having a discussion around Ehlers-Danlos or any connective tissue
oh,
disorders. Did you want me to address this?
Yes, please
yes.
do. That
Okay.
makes Eric very happy.
Okay, wonderful. So again, it really all comes down to that collagen elastin balance. When everything is balanced, life is good. However, what happens with connective tissue issues is likely there was a trauma early on in life that created this hyper rigidity with the breath. So now the body's collagen is moving to the breath because we've locked ourselves in as we're going through the developmental stages, and the collagen keeps getting attracted to this space because there's not that proper foundation being built here. Now that's leaving the limbs without that structural support. So now we have laxicity in the limbs. So the goal is again that we open up this space and we support the migration of the collagen to the balance for the elastin. So that's really what it comes down to. I have a number of teachers that have connective tissue disorders that have used this and have made tremendous progress. We even have some interviews with them that I did so that people could hear their story and the process that they went through with this. So this is something that will benefit that as well. Sometimes people think, well, if I'm creating more mobility and I have hypermobility, will that be negative? It's not. It's understanding the goal is balance, and this is a process to bring balance into the body.
Yeah, because you're opening flow. It's not like you're doing yoga. I mean, which is, I said, one of the yeah, I always noticing the people who loved yoga the most were the people who should be doing Tai Chi or weight training. Because yeah, it's strength, but this is different. You are increasing local um you're not really stretching. I mean, in my mind, you're not stretching. You're opening the local tissue. And someone asked, "What's the difference? Difference between this and massage?" And I mean, this is, to my mind, this is a way to because you're trying to really have a conversation with an air with a local area. And it's a more personal discussion, if you will, in
Yeah,
my
well,
opinion.
and to that point, if I want to stretch, let's say I have tight hamstrings and my goal is to be able to touch my toes. As I'm stretching, if all I'm doing is stretching, basically I have available to lengthen what's available. If you go into a stretch and you feel, where am I limited? So right now, if I feel some limitation in the back of my hamstring, then I can fascia decompress. What I do is I add more tissue to lengthen. So that's the difference between stretching and fascia decompression. And the thing is, because people, when we're stretching, if you have a goal, I want to do the splits, and you end up forcing, you end up really playing with the stability of the ligaments because people aren't stretching mindfully. So again, the decompression is the key. And then it's a complement to all of the other things that we do, as opposed to just do this and not that, never saying that. But when you bring this work into your life, it improves all of the other things that you're doing by making sure that all of the cells are getting properly fed and clean.
Yeah, I, I think that that's the important thing here is that you're not stretching. You're opening. Opening. You're inviting communication.
Yes.
Yeah, and you're inviting tissue growth
Yes.
in a very positive way. Someone asked a question that's not really on topic. Actually, two of them, real quick. One of them is just when people are so many people are so tight in those rhomboids, the scalene, all that shoulder girdle.
Yes.
That seems to be
So that is this, right? So that's all the stuff that we did. When we have a weak diaphragm, we fall in, the shoulder blades migrate, we get locked in this alignment, and then now we have tremendous tension in the back of the body. Bringing the rib cage up and forward is all the work that we do through the rib cage, and then supporting that breath creates this strong foundation. Having said that, this is driven from the feet because now we're patterned in to how we walk as well as to what the arms are doing. So even as we're sitting here, if we just turn the palms forward, there's an automatic, nice little gentle lift of the rib cage. So just being aware of all the cause sites that affect the areas of concern. I was so grateful. I just had one of my clients who shared in her x-ray, she gained 5 degrees in her cervical spine from doing this work. And she shared that on an x-ray. So these things, and that was from, doing the full body work. If she just focused on her neck, never would have made that kind of progress, if any. In fact, that might have been detrimental to her condition as well.
yeah. That I again. This is the way we think in our modern world is always, I have a problem and here's the one solution, and it's usually right next to the problem.
Yeah.
And that is just not how the body works. And,
I live on a river, and what I love is I was looking and there was this current of debris and garbage, and I'm like, okay, what upstream is blocking it? And sure enough, not too far upstream, there was a tree that had fallen in. So everything is upstream. If we have an issue somewhere in the body, that there's going to be a blockage somewhere before that issue. So just to note, always.
yeah, and, and we do this. I mean, I myself, you get a stiff neck and you want everybody to work on your neck.
Yes.
But what about how you're holding your body? Why is the neck forward? I mean, it's just, and that's the beauty of your work is that you're opening, and we don't have to know exactly how to fix everything. But if we start from the diaphragm and include the extremities, it's you got, yeah, especially the feet. I had, well, actually, I'm opening my palms right now and realizing, oh my God, when I stand, I don't, because I think sitting and working is a huge problem. But I stand all day, but I realize that. But I'm still having my hands are always, palm down.
Well, and it's funny because I mean, I know there's a comment now like sitting is the new smoking, and definitely people sit more than they should, but we
But
can stand incorrectly and still create as many issues in the body as well. Because if we're not standing properly or sitting properly or sleeping properly, like all of it, we want to keep the body open and flowing. And whatever we do for long periods of time, we start to get stagnant. And if we don't release that through stretching on occasion, or when I say stretching, stretching is great again, but that's not going to unlock that. So if I have a shoulder and I'm like, I've got frozen shoulder, I can't stretch that away. I have to lift a line so that I gain that full range of motion. So again, that's really where we just have to look full body. And you touched on something I just want to mention about trauma as well. What's so lovely about this work is if people have a lot of trauma from past, you can't talk that away. When we do this work and we open up the areas that have been blocking that negative emotion, that comes out naturally. So it's this beautiful non-judgmental way of releasing past trauma so that we can look at that trauma from a different perspective and then view it sometimes as a gift. And I mean, I don't say that in jest because I mean, I know some people have had some pretty severe, scary things happen to them, myself included. But I can go back and I can look at the version of me in my 20s when I was an absolute nightmare and realize that if it wasn't for that young, damaged woman, this work wouldn't have come to me. It was from that place that this birthed. So there's always gifts to what has happened to us. And that's the lovely piece of this work when we can look at ourselves from that place of non-judgment and get out of the cycle of emotions and mental thinking that get patterned into the fascia as well as the physical. Then we can release all of it without judgment and then move forward with an open space in our mind.
yeah, yeah, the open space. That is the that is the prayer. Yeah, yeah, to actually be in the moment instead of most of us, yeah, the past and the future. Yeah.
Yes.
Yes, but this does it. I mean, I'm just when I'm sitting here is kind of amazed. I'm sitting here just with my palms up on the desk, and my whole sitting pattern is changing. It
One
just
of the things we share all the time with our blocks, I'd love to talk about the reason that we have the tools that we do, but even just using a rolled up towel behind you when you're sitting, it just prompts you to stay upright because now you have a prop behind you so you don't fall away or the towel will fall. So many simple little actions we can do. Another seated one that's great when you're sitting, you want to have your knees 90 degrees and both feet planted firmly on the floor. If we hook our feet under the chair, it's kind of like we're standing with that negative alignment, but we're seated and that's affecting the pelvis and then everything up the chain. So sitting and squeezing a towel or a block, that really supports strengthening the adductors, which helps to bring balance to the sit bones. We want to feel like we have equal weight on both sit bones, knees aligned, and then we can support the most profound breath. As soon as the lower body falls away, now we're impacting the diaphragm's ability to do its job. And when it's working fully and completely, we feed the body 600% more oxygen. Huge amount. I mean, really, that's what it comes down to. We want to make sure all of the cells are fed properly so that the ATP can be generated and so on and so on.
yeah, yeah. It's just the debate. It's always funny. Like I said, we spend so much time, energy, and money trying to find the magic solutions. And again, this isn't going to heal everybody from everything, but it's going to give you a big leg up in life, no matter how you feel. If you get this connective tissue open, your body's going to work better. And
Yes.
and yeah, I just always in awe of simple things that are profound. And this is one of them. Deanna, thank you so much. I think we have to probably wrap up, but we'll try to get maybe back to some of these questions over time. And yeah, and we'll do this again because I'm getting, I said I'm someone who like many people love the idea of things, but don't have much in the way of follow through. And I think and this is the more you can make this a part of your life, the richer and the healthier you will be.
And Eric, may I just talk
Oh, the
briefly about
block,
the tools
sure.
so
Oh,
people
yes.
can really
Yeah.
understand why they're so helpful? And the towel works great, but the reality is the fascia will grip and adhere to bone with a 2,000 per square inch seal. Our tools are actually made of reclaimed elm from Winnipeg. We have a factory right here in Winnipeg, so we're not cutting any trees down. We are giving trees that are cut down new life to heal others. And they are specifically designed, specifically shaped to be able to go deep, but with comfort. And because bone and wood are similar in density, they actually love each other. People think, wow, it looks like it would be really painful to lie on this. Those pressure fibers kick in and we get really deep, and it's a beautiful connection. And of course, you're always in control of the amount of pressure that you put into your body. And there's two sizes of tools that we have. One is the buddy for, we always say, people over 5 feet, the baby, people under 5 feet. We also sell both because both are so loved by our community because you can interchange. There might be some positions where you feel the big one feels nicer for you than the small one. We also have a whole bunch of double blocking classes in our membership. So we're sharing with everybody our starter program, which comes with the option to buy one or the other or both. And then in our starter program, we have 9 guided classes that have both a block class plus a corrective exercise. We have a 2 hour seated chair class for people that struggle. And actually, just doing seated chair work is great because we move into the fascia from a different alignment. And sometimes the chair work can even go deeper. We also have conscious walking videos, blocking around the house, and some other introductory videos to really teach people proper postural foundation. So I just wanted to share what we are offering, and so people have a really good understanding.
Oh, absolutely. Because this is, I said, this is work. I mean, the beauty of it, it works when if you, no matter how often you use it. But if you could make it a really daily practice, I think it's transformative. But
Yes.
even if it's a few times a week, I still can't get over. The only thing I was able to do today was like I did one diaphragm rest and the mouth, and I feel different. And I'm just sitting here, I said, with my palms up in the air, and all of a sudden my shoulders are back without thinking about it.
Nice.
Yeah, and I'm upright. So yes, thank you so much. Look forward to playing together again and really sharing more of what's possible. Because yeah, we how do you say, the creativity of the human spirit, and thank you, Deanna, because I just want people to understand the creativity that you have put into this. I mean, like, yeah, yeah, it's pretty amazing. It's pretty amazing, and the deep thought. So I want to thank you for that. It's I don't know if people. I think if they watch and follow the program, they'll learn by doing it. As they feel in their body, they'll really appreciate you know um, the depth of knowledge that you have brought to this area. So anyway, thank
Thank you
you.
so much, Eric. I so appreciate you and again, and Darcy, and being able to be here with your community. Thank you so very much, all of you, also for listening and taking the time.